Hello everyone, welcome back to Good Morning Sri Lanka. Now on today's show we're speaking about something that's very important to us, and that's our vision. It's always it's always good to be informed actually about the different ailments that can occur especially as you grow older, and it's always good to keep a lookout. So we were speaking to Dr. Rangika Gunaratna, and he was telling us about some of the red flags that you should look out for when it comes to cataracts. And I think we've covered all the symptoms, didn't we, doctor?
Yes.
So now I think we should speak about once it is detected. I'm assuming that you have to go to a qualified optician or you have to go to a qualified consultant and sort of confirm that, isn't it?
Yes, once the cataract is detected or suspected, they should go to a qualified person who will be able to look at the eye with different instruments. There are different instruments where we can check the eye clearly and detect the cataract. Then we can grade this cataract and decide whether it should be done or not, to be observed. So every cataract need not be operated.
Oh, okay.
It depends on how it is affecting one's day-to-day life. If somebody has good vision, they can do all their things normally. If everything else in the eye is normal, even with a mild cataract, sometimes we observe. They can be given glasses to improve their vision also. But when we see the vision is getting affected due to cataract, that person's life is getting affected due to cataract, it has to be removed. Also, any mature cataract has to be removed. So cataract being mature means the cataract has come to a stage where it has to be removed, otherwise vision is so poor.
But doctor, isn't there a chance that a mild cataract might then develop to something more severe if you leave it untreated? Does that happen?
Yes. Now cataract, if we develop a mild cataract, if that can be observed, then it can be observed. I mean, people can observe periodically and see whether it's getting worse. Cataract will not suddenly grow to a very, very mature stage. So it will slowly, it's a condition where it slowly grows from one stage to another stage.
So there is no real advantage of removing it earlier or later?
Yeah, there are advantages also. It depends on the lifestyle. Somebody who is driving, somebody who is very active might want to get the cataract removed early stage. If you could take us for example, some old arch you see at home who is not having much visual problems due to early cataract can be observed.
So it really does depend on the situation, I guess, at the end of the day. But now this is the eyeball that we're talking about, and I'm sure that people are kind of skeptical about the type of surgery that goes on. Now does it involve, what are the surgical procedures that go on there? Because it's a very sensitive part of the body, isn't it?
If you look at the surgery of the cataract or the eye, it has developed greatly. It has, from the early stages, now it has come to a very advanced stage. So when we consider cataract removals, it can be done very safely. So that is a plus point for doing early cataracts and also doing safe cataract procedures. Even the most mature cataracts can be removed with the newer techniques now. Also, those days when the cataract surgery was in initial stages, people has to be given injections, put stitches, and
so it's under general anesthesia,
and also stay in hospitals of these procedures. Now these are done as outpatient procedures where patients come, get their cataract done, and then they go home. And the visual recovery is so fast, so within 2-3 days they go back to their jobs.
I see.
So the advantages are very much with the newer types of surgeries. I'll explain a little bit of what is the procedure later. But is one procedure which has been very successful all over the world, and the technology also has come to a level where we can do very, very successfully the procedure within very few minutes. And also once you detect a cataract, now once we decide that we have to do it, so that person has to decide with the doctor what procedure they are going for. And when the procedure is done, generally most of these patients, we do a blood sugar test and an ECG to find out whether they are physically healthy. If they are physically healthy, then this procedure can be done. The procedure is done in a theatre with a very, very sterile conditions, because the eye is a very sensitive structure, also very important structure, so we have no chance of getting any infections into the eye. So it has to be done in a very sterile conditions in a strictly aseptic theatre.
So it is a very, very advanced surgical technique that you're using here for the eye, but it's something that's safe, something that's fast as well, and we'll be speaking about what exactly this technique is, and put your mind at ease about any doubts you may have about cataract surgery. Stay with us, we'll be right back on Good Morning Sri Lanka. Welcome back to Good Morning Sri Lanka. We have consultant eye surgeon Dr. Rangir Gunratna with us in the studio this morning, and he's been putting to rest any doubts that you may have about a cataract and what it is. And I think we've spoken about the symptoms and the causes, Doctor. Now I'm sure that everyone would like to know about the new techniques that are available, surgical techniques that are available when it comes to treating cataracts.
Yes, as we were talking about cataract removals, cataract is a problem with the structure of the lens in the eye. So basically, to give a better vision, as I explained, for us to have better vision, light has to go through the front of the eye to the back of the eye, and also it has to be focused by a lens. So when a cataract is there, that function is not happening. So basically, cataract lens has to be replaced. If you look at the eye, this is the lens. It's quite a large structure from the model, but it's quite tiny when you look at the eye. So what basically, when a cataract surgery, what we do, we put anesthetic drops to the eye, so patient will not feel any pain. So that's the first thing. So once that is done, patient has to lie down on table and look through a microscope. So we look at the eye through a microscope, which gives a magnified view of the eye. So we basically see all the structures of the eye very clearly from the top. So once we see that, we make two tiny holes on the either side of the cornea. Cornea is the transparent area of the eye, so which will not cause any bleeding because there are no blood vessels which can bleed there. So we make two tiny holes in the cornea. Through these two holes, we go into the eye, and earlier I showed the pupil, the round area in the center. Through this, we can go through an ultrasonic probe. That probe goes in and dissolves and take this lens out. So it basically breaks this lens into small pieces. This technology is known as phacoemulsification. It breaks the lens into small pieces and suck it out. Basically, it is a big machine, but what we are having in our hand is something like a pen, small structure. So with that can be kept safely on the eye, and that structure will go and dissolve this lens, and little bit by little bit it will suck it out. So this whole process can take 2-3 minutes to remove cataract. So once that is done, now we are not having a lens inside our eye. So this particular technique, what we do is, now our normal lens has a covering around the lens. So this lens is covered with the covering, something like a cellophane covering. So we make in the surgery, we make an opening in the front of this covering and suck out everything inside this cover. So basically, we are left with a small bag with the opening in the front.
I see.
So that is the structure remaining from the lens. So to that structure, that bag, we insert the lens. So lenses are also now developed to a certain level, so they can be inserted to a small tiny incision, which is less than 2.2 millimeter. Once lens goes into the eye, it gets unfolded and stays again like a lens.
I see.
So that is the process of the cataract removal. So once that is done, we seal these two holes, so we don't have to put any stitches. So these holes get self-sealed, and the patient is sent home.
And this surgery, you said, takes all of
maybe about 5 to 10 minutes.
So
as we are talking about replacing the lens, we have to tell about the lens also. That's another question people come and ask. Are you going to only to remove the cataract? Are you going to put an implant? Or can I stay without the implant? So those are the questions people come and ask from us. So generally, when we remove cataract, we always insert an implant. The reason is, if you take the lens out and keep the eye without a lens, the vision will not be that good. Vision will be extremely poor. But that was a technique that was done about 30 years ago, where they just removed the lens because there were no implants at that time. But as the technology has gone to the very advanced stage, now we have implants which can correct the vision.
And I think you brought some of those implants to the studio as well, doctor. So maybe we can have a look at them?
Yes, when you look at the cataract removal and putting an implant or a lens, there are different types of lenses that can be used. So basically, what we are talking about, the modern lenses, which are called foldable implants. So I'm going to show a few models of implants. Now there are implants. Now this implant is going to replace the lens. So once the lens is replaced with the implant, so this will be the type of the implant that we see in the most newer lenses. The implant is folded into a smaller size, and then it goes through a small tiny hole, something like 2.2 millimeter hole in the eye. So once it goes into the eye, it appears like this inside the eyeball. but actual implant size is much smaller. If you look at this model of the actual implant, this is the appearance of the actual implant inside this glass box. So which is very, very tiny, but 6 millimeter of size. Now also about the different implants, now when we talked about cataracts, patients come and ask from us, do we need an implant? Or what type of implants are available? So there are implants, usually the olden, previous time we had the implants which improve our vision for distance.
Okay.
So when you put the implant, we take a measurements. Each patient has different measurements. So on the measurement, we take the power of the implant, and that according to that is just like going for a spectacle shop, buying a spectacle of different powers. You get the implant with different powers. So with the implant, that power is a constant. So they see whatever distance we plan them for. Okay. Generally, most patients get the eyes corrected for distance. So generally, with most of these implants, they need to have glasses to read.
I see.
But there are people who can read without glasses also, but most people need glasses to read. But as technology become more, there are implants which can correct distance near both, which are known as multifocal implants.
Okay.
So they see far, they can see intermediate, they can see near. So those are the more advanced type of implants. So but not everybody is suitable for that sort of implants. So people have certain amount of eye problems and the eye curvature problems. They might not be suitable for those implants, but there are people who are suitable for these multifocal implants also. Then some of us have problem with our cornea. The cornea can be a bit crooked. That can be from birth. So those people who have been using glasses before, even if you do an implant, they will still need glasses to see far also. That is due to the crookedness of the cornea, which is known as astigmatism. So it's a medical condition of the cornea. So that also can be corrected with lenses. Those lenses are known as toric implants. So we have a range of implants now. Implants which can correct distance, implant which can correct near, implant which can correct distance, spectacle problems also. So those are the different types of implants available. So there is a lot of advances happening in the field of cataract surgery. So we call cataract removal as now more like a refractive surgery, where we try to give the best vision to patients. And also people come and ask from us, has this lens to be removed later? Is it lifelong? Generally these lenses are lifelong. Once you have an implant, it can be kept lifelong. But if there is a problem with your sight or problem with the implant, it can be rarely explanted and put a new implant also. That chance also possible.
So there are, I'm sure once the cataract surgery is done and the new implant is in place and you go home, because you're sent home on the same day, I'm sure there's some procedure to take care of it as well. So what's the aftercare like?
That is also very important. Surgery? It's not only the surgery which is important, that's very important how to look after the eye. So generally different surgeons have different protocols of looking after the patients once the cataract removal is done. Generally they need eye drops. There are drops to prevent infections. There are drops to prevent eye getting what's called inflamed. When any procedure is done in any structure, that structure can get reddish, swollen and painful. So to prevent that, there are drops. So those drops has to be used for few weeks to get a better outcome. And also patient have to look after their eyes. They should not rub their eyes for few days. They should usually for 3 days they should not have a bath, head bath, but they can have body wash, they can wash their face safely, carefully. So those are the basic things that we tell them to adhere to. But most of the newer surgeries, they start their normal routine within a day. Most of them can drive within 1 or 2 days time, and they can start their normal work very soon.
You take care of yourself properly, and according to the instructions that the doctors give you, there shouldn't be any problem at all. And like you mentioned, it's a very common surgery now, very fast surgery and a very safe one. So I think we've covered everything about cataracts this morning on Good Morning Sri Lanka. Thank you so much, Dr. Angika, for being with us on the show. And we hope that you at home learned a lot from this as well. Information is always good to have. So with that, we're going to wrap up today's show. We'll see you tomorrow as well. Take care.